So the real picture is the one on the left, not on the right. And it's called coronavirus because it has all these protrusions on the surface that from outside looks like a crown, but otherwise it's one of the very common viruses. The new one, which appeared a month ago, no, 2 months ago, is very close cousin of SARS virus that we were dealing with 16 years ago. Almost 80% of genetic sequences of SARS virus is shared by this new virus. And 96% of the bat virus is shared by this new virus. So that's why we know that it came from bat virus and it shifted to animal and from animal to humans. It's much different than SARS. SARS was very severe and acute infection. This one, in vast majority of people, causes very mild symptoms, but it spreads much better. The way it spreads really resembles influenza. It can spread from people who didn't develop symptoms yet, and it spreads very quickly. In Wuhan, it was 63%, so almost everybody, like in initial stage of Wuhan, the 1,000 of 1,716 healthcare workers were from Wuhan. So the Wuhan, the first place, they constituted 15% of cases classified as critical, and they had 5 deaths at the time of this publication. This number is set to rise. But it worked. Locking entire province and entire city, we can discuss the cost of such intervention, human cost of such intervention, but they see decreasing number of cases. And this blue shape is by the date of onset, so of symptoms, and this is by the day of diagnosis, but either way you calculate it, they are over the peak and the numbers are coming down. So definitely this draconian intervention worked. But we see the new places. If you follow the news, there is now, we see cases in Korea, we see cases in Italy. We were watching with amazement the Diamond Princess cruise ship having more and more cases. So even if the intervention was amazingly successful in China, it doesn't mean that it will eradicate this virus from the entire world. They must realize in China that it's not over. So the only advantage of such draconian intervention is to delay to some point in future where the epidemics will slow down. And it's a question, what is the end game here? Delay till vaccine? No, it's not possible. Vaccine will take at least a year, usually 18 months to be developed. Delay, hoping that it will decrease in the spring. Probably that, because quite a few respiratory viruses decrease when it gets simply warmer. And the final question would be maybe they are delaying until they build capacity in different provinces. But I don't think that they expect this virus to go away. They know very well that even if they will control it in China, it will come back from some other country. A few slides, how this coronavirus compares to influenza, because we were watching these numbers about so many thousands of cases, so many thousands of deaths, and then everybody was very scared watching these numbers. But CDC Atlanta produces weekly influenza surveillance report, and they publish it weekly on their website. And then it's a very boring and long report, but in the end they produce conclusion, summary for the week. And on this week 4, ending January 25th, they produce the following conclusion. CDC estimates that so far this season, there have been at least 19 million flu illnesses, 180,000 hospitalizations, and 10,000 deaths from flu. And that's only US and only from the 1st of October. So that's the number that US is seeing every year. They actually mentioned that it's no different than a usual year. They compare it to average. So 2 weeks later, I pulled out the same numbers, and this is now week 6 ending February 8. And then CDC estimates that 26 million flu cases, 250,000 hospitalizations, and 14,000 deaths. So over just 2 weeks, USA had 7 million flu cases, 70,000 new hospitalizations, and 4,000 new deaths. But nobody is postulating to close the US border because of that. So these numbers are actually very high, usual, but nobody talks about them because they happen every year. Now, if you take these numbers and calculate the case fatality rate, what I did for the COVID, then if you divide 26 million by 14,000 cases by 26 million, the crude mortality is very low, 0.05%. And we know that everybody gets flu, but hardly anybody dies. But if you take hospitalized patient in US, 250,000, and same number of deaths, now the mortality rate is 5.6%. And that's actually what is being reported. These are the people for COVID. These are the people who are sick enough to come to hospital for testing. Not everybody got hospitalized. And that's why this number is so impressive. But if you compare it to influenza numbers, not that impressive anymore. So why we reached that stage? That there is a COVID and everybody walks around with masks that probably don't help outside hospital setting and people who are not sick themselves. This was one of my favorite slides. This is long snaking queue of people in Daegu City, Korea, waiting to buy masks. I'm sure a lot of spread is probably happening while waiting. And this is my absolute favorite. Mass wedding in Manila. How do you do that with all these masks? And how does it help? And then I don't know. But people are scared because they see these pictures all the time. Are we overreacting here? Like, these space suits, and then top of the head to the very bottom, everybody is dressed like this, and then 6 people to 1 patient, and we are fed these pictures in the news all the time. So obviously people will think, oh, this mask will be good. But even if I compare to my 2003 experience, we were grossly underdressed. We were like half naked. We had just gown and gloves and mask, and that's about it. And everybody who was gowned and gloved and masked never contracted this SARS. And it was at least 20 times more deadly, at least. It was really deadly disease. It is in something we call containment. Everybody hopes that, it will go away if we do very aggressive intervention, and especially everybody is encouraged after China and Singapore. But then there are all these other countries that don't report any cases, and I'm sure they are now slowly starting to develop a lot of these cases. They just don't know about it, and there will be a lot of reintroduction. So at one point, there will be a political decision to switch to something called mitigation. You just prepare your healthcare workers, you prepare your hospitals, you cut down on the big meetings and so on, and you just soften the blow. This contact tracing, isolating, and so on is just simply not sustainable. This is the Singapore alerts. Maybe for the sake of time, I will move more quickly to what we can do about it. It spreads by droplets. So then if you happen to be within 2 meters, then you may inhale it. But if you happen to be outside, then you can touch something and then touch your eyes, touch your nose, touch your mouth, and it actually spreads that way. So there are studies showing that the best advantage of using the mask is not that you will not inhale it, but you will stop touching your mouth. And then that's how it works, most probably. This is, I apologize for these next 2 slides, but this is like straight off the press. It was just published like 2 days ago. And they put together data on different coronaviruses and how long does it survive. And I would just only pay attention to where it says SARS coronavirus. And it actually can survive in laboratory 4 to 5 days when it stays. And that's probably how it spreads. People touch it and touch themselves. Now, in warm countries, it will stay much shorter. Virus doesn't like warm temperature, so it dies quicker. I would say it's hard to tell. Probably it will stay for a day, maybe 2 in Singapore, and in Wuhan for 3 or 4 days. Then I will just skip this. What can we do about it? You all saw it. And then see, mask is nowhere on this list. It's all about hand washing and hand washing and hand washing. This is because it spreads that way. If these droplets fall on the surface, people touch it and introduce it to themselves. That's why that's why all the interventions are about hand washing. If somebody wants to cough or has to cough, then it's much better to do it that way, because if you cough into your hands, then that's the best way to spread. We know it from the hospitals for antibiotic-resistant bacteria. To wash off bugs from hands, it takes 1 minute of soap and water, or maybe 15 seconds of alcohol-based hand rub or sanitizer. But I'm sure all the sanitizer are already sold, so you will never get it in any store. So soap and water is actually good.
So the economic impact, well, it's stark. 38 countries worldwide, I think it might be 39 now, have recorded cases of the coronavirus, and there is a sense of global panic. China is completely locked down. That's the world's second largest economy, has pretty much been locked down for about 6 weeks. There are signs that there is some economic life coming back, but it's not much. A lot of people even the major cities are still working from home. Most of the factories are locked up. The supply chains that we really rely on around the world are really stagnant. Growth predictions are being revised. Some economists have said that perhaps across 2020 there'll be a -1 deficit on global GDP. Well, that's a big figure, 1% of global GDP being lost throughout the year. Stocks around the world are volatile, government bond yields are up and interest rates are down. These are key signs that something is afoot, that the investors around the world are very, very jittery. Government stimulus are being put in place. China's announced a stimulus. Last week, Singapore had its budget where it offered a lot of stimulus effects, particularly to the tourism industry and airlines. Monetary policy easing. These are all signs that we are heading towards a global recession. It's a horrible word to have to say, but even economists now are really realizing that because supply and value chains around the world are so jammed up, that even if China moved back into full economic mode tomorrow, there's going to be a huge backlog. So why does China's airline collapse really, really affect us? Well, those two kind of explain it. China was the world's 3rd largest international air market up until 6 weeks ago. It's now fallen to 28th place. There were predictions up until about 2 months ago that China was on course to become the world's largest air market by the middle of this century, but the middle of this decade would overtake the US. At the moment, unless it really restores its capacity very, very quickly, that's unlikely to happen. So why is aviation so vital? Well, as I just said, 35% of global trade by value is carried by air. The Association of Asia-Pacific Airlines has said that this year there could be a $27.8 billion accumulated revenue loss for Asia-Pacific Airlines alone. That's just in Asia-Pacific. If you add in airlines around the rest of the world, that's another 1.5. Globally, airlines this year could lose $29.3 billion. That's a huge amount of money. The doom and gloom continues. Global tourism is predicted to take a hit of about $80 billion this year. Chinese tourists into ASEAN, which, as we know, are drivers of the economy, the consumer economy here, predicted to be down up to 40%. Just mentioned the APAC Airlines figure. Singapore Tourism Board has said that its visitor numbers this year could drop by 25 to 30%. Well, obviously that's over a quarter. So I thought I would just finish off this presentation with sort of 6 conundrums, 6 lessons that we could learn. And these are basically for discussion. They're not really cast in stone. So the first one is that there's a business quest for agility. There always has been. You know, if you go to any management conference, they will tell you that business needs to be agile, especially in the technology era. But when a crisis like this happens, CEOs and every executive looks back at their business model and looks, well, how can we actually deal with this crisis? And how can we be ready for the future? So CEOs at the moment are looking at both preemptive and reactive efforts. How can they actually mobilize their companies when cash flows are probably going to be lower? And how can they keep the business stable, afloat, and thriving in future? If you look at China, if you look at some other countries in Southeast Asia, of course, people are working from home. So how do you manage their health and safety if they're actually working from home? You can't have control of them all the time. And how do you manage their productivity? There are reports coming out of China at the moment that particularly in the creative industries, like marketing, PR, and advertising, the productivity has completely collapsed because people don't have the motivation. They're working at home. They're not used to it. It doesn't really align with their working culture. So another issue is that international worker chains are being jammed up. I was talking to a guy today who works in oil and gas, and he was saying that a lot of people that would work in these industries from Bangladesh or India, they're staying in their countries. They don't want to travel out and even go back to work. So there's going to be an international worker chain crisis. Managing currency fluctuations, that's a big issue for companies, especially if you're trading in different countries. Building partnerships, looking at how you rethink your marketing. One of the first lines of any business that gets cut during a crisis is marketing, because it's a high cost. But we don't know how long this crisis will go on, but should we stop marketing? Well, I would say no, I'm a marketer, but businesses will need to somehow plan for the rebound, because the rebound will come. And if we look at travel, you know, there's a lot of speculation at the moment, but if this virus is contained in China, excuse me, over the next few months, that the rebound for the Chinese National Day holiday in October will be huge, and that there will be a lot of Chinese travelers that actually saved up and couldn't go abroad during the Chinese New Year will want to spend and travel at that time. But, of course, they will want the right deals, and their destination choices may have changed. You know, over the last 2 years, Japan and Korea have been very, very important markets for outbound Chinese travelers. But at the moment, that looks unlikely. Singapore, too, at the moment. So where will they be going? Well, perhaps Indonesia. They don't have any cases, as Dr. Piotr said. We don't know if that's true, but they haven't reported any. We knew this, but coronavirus has really confirmed this, that in times of crisis, people and businesses turn to their governments. They do. Singapore is a really good example of that. So we saw in the budget last year, the budget last week, that the government tried to give something to everybody, to businesses, to elderly citizens, to people working that wanted to retrain, trying to offer something to build hope, to build confidence. If you go to the bottom there, build confidence and stimulate demand. That's going to become a huge mantra in business over the next few weeks. We also need to redefine the travel narrative, get people confident to travel. Now, that's quite difficult in Singapore, because Singapore is essentially an inbound and outbound market. There isn't really any domestic travel because you can't go anywhere. It's a city-state, right? But in countries such as Indonesia, Malaysia, Thailand, there are going to be huge campaigns to get people traveling domestically, get them used to traveling again, get them feeling comfortable with getting on a plane, going somewhere different. Also, for countries that have suffered economically because there's no Chinese travelers coming on, no Indian travelers, having domestic travel just stimulates some revenue and some demand. Long-term lifestyle disruptions. This is an interesting one. In China, there's a lot of talk about this at the moment, that so many people have been homebound, not just for work, but they're just not going out. They're being encouraged not to go out. If you read a lot of the messaging that's in Chinese communities at the moment, it's about keeping distance. It's about staying home, because that's the best way you can look after your community. So people are eating out less, they're not going to the cinema, they're not going to the gym, concerts, events are cancelled. There's a fear of travel, as I mentioned before, so future travel plans are being postponed, they're on the back burner. Dietary shifts. You know, there's some reports in China, some studies going on, that actually people are eating much healthier. They believe if they eat much healthier, they have less chance of catching the coronavirus. There's new purchasing patterns. You know, it's not just masks that we're buying, it's a whole range of hygiene products, especially online. And as the job uncertainty continues, will more people save and spend less? If they do, that has a contracting effect on economies. Shifts in the convenience economy. Well, this is related to the previous point, but you know, we've got used to convenience. We've got used to contactless. We've got used to home ordering. We've got used to being lazy. But has this homebound nature of what we're going through at the moment, is it going to exacerbate these effects? Are we going to have more gaming, more streaming, more home cooking? You know, there's more opportunities there for for recipes, for product makers that can produce ingredients that are specialized for home cooking recipes. Is travel going to be more vicarious and virtual? Are we going to be traveling by watching TV programs or game-style travel events? Improvised deliveries, cashless. Are we just going to go very, very cashless? There was a good example in Vietnam a couple of weeks ago. The State Bank of Vietnam actually put out a circular, and it had TV adverts, and it was encouraging people to use cashless payments, to use QR codes, because it said a lot of the banknotes there are quite dirty, they carry a lot of germs. You could catch the coronavirus from banknotes. It's probably not true, but at least it promotes cashless payments. Financing future demographics. One of these things that Dr. Piotr mentioned is from the research that's been done into the coronavirus, is it does seem to affect elderly people more. Asia has a number of aging societies. 5 of them in particular, China, Singapore, Thailand, Korea, and Japan. They are aging at quite fast rates. So this will change the way that we spend on healthcare, the way we look at innovation in healthcare in future, scientific and technological research. Will this be sped up because of what's happened with the coronavirus? It's very, very possible. How do we educate the next generation on virus risk protection? These issues will come to the fore over the next few months.